I'm Ems, 24 years old. Andito po ako sa CSA ngayon dahil matagal ko na pong gustong paggawa itong chin ko na nagko-cause din ng pagka-double chin ko. Please don't forget to subscribe and click the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll be doing a treatment for short chin or a retracted chin. Let's welcome today Miss Emerlinda.
Hello.
Hi, Ems. Ems is our nurse here in our clinic. She's only, how young are you?
24.
And belated happy birthday.
Thank you, Doc.
Okay, she turned 24, okay? Yes. And a while ago, I was doing an assessment on Ems and looking at the upper third, middle third, lower third, those are the proportions of the face. I noticed on the lower third, there's kind of like this shortening, okay? If you do the rule of thirds, so the lower part of the face, kind of like deficient, right, Ems?
Yes, Doc.
And she also noticed that it's also retracted. From the time that you were learning on aesthetics, right? You noticed that you lack on the chin part.
Yes.
Yeah. So if we do like a Ricketts E line there, there's a lack of projection, and at the same time, the vertical dimension is deficient also. And this is something that Ems inherited. Okay, it's not from aging. Okay?
No,
So this is a genetic condition. Okay. And because of the retracted chin, it also created kind of like that double chin or like this prominence of the under chin region. Okay, kind of like you're noticing you might have some submental fats, or you were thinking like your skin here is saggy already.
Yes,
but mainly it's because you have this, like your chin lacks this projection. Okay, so if you look at her profile view, you will notice that it's really backwards, right?
Yes, no.
Yeah, okay. And I was also checking on the lateral chin area because if you do a total assessment on this chin region, you have to also check on these lateral aspects here. Kind of like this part here is more deficient than the other part, the opposite side, right? You notice that too?
Hindi ko masyado na.
Yeah, she's not really noticing on that one. But if you're gonna really take a closer look at it, you'll notice there's more of like a, what we call hypoplasia. So there's this chin hypoplasia or mandible hypoplasia. Some medical terms there, okay? For today, we will be doing a non-surgical correction for that, okay? So nothing invasive, nothing surgical, nothing drastic. We want Ems to be still natural looking and very recognizable.
Yes.
Okay? So what kind of treatment, what procedure, we'll show you when CSA Medical Aesthetics return. And we are back. So we are doing chin enhancement for Ems. okay, before the procedure, we'll be doing our land markings. Okay, so initially I draw a straight line, a vertical center line there. So this is the center of our face region, and then I divide actually the chin region into like 4 compartments. So I make another horizontal line here to transect the vertical line there. Okay, so markings are essential for us to be able to know where to place our product material. And also, I am assessing the sulcus here, or the so-called labiomental fold here. I notice also like there is some deepening in this part here. So we want to improve this deep sulcus region here. So I'll make a kind of like a longer kind of line here, horizontal. So it's like a rectangle here. So I want to improve this upper section of the chin part, okay? To improve this lower aspect of the, or inferior to the lower lip, I want to have some volume here. And at the same time, because M's would want to have a feminine chin, we have to make sure that we also fill in the apex of the chin here. Okay, so apex of the chin we will be also filling in. Okay, now since we have shortness of our chin length, we also wanted to improve this mandibular line here. Okay, I'll be doing also like a filling in of this part here, and also on the opposite side a filling in of this part here, like a minimal only. I want to balance the right to the left side. Will also improve the asymmetry, and at the same time I want to correct this double chin already via just working on the chin. Okay, now those are surface landmarks that I have. Okay, what are the vital structures that I need to avoid? So we have on the lower third, okay, the so-called mentalis foramen. And how do I locate that? By palpating supraorbital foramen here and make a straight line. Okay, so here in this aspect I have the mentalis foramen. Same thing on the opposite side, I locate the supraorbital foramen here, and then that will be the location of the mentalis foramen. This foramen contain your mentalis artery, mentalis vein, and mentalis nerve. So we want to also avoid that in doing injections. Okay, another thing is a branch from the facial artery which comes out from your antegonal notch here. So actually it goes towards the corner of the mouth, giving off those labial arteries, but there's also like a submental artery going here. So we wanted to avoid those kinds of vital structures to avoid complications. Okay, now as to the anatomy or the layer of placement of material, so this part here, it's either onto the bone or subcutaneous or subdermal. Okay, and what kind of product will I be using? So since I want to have a very good chin projection as well as like lengthening the chin or elongating the chin, I need a product, a filler, specifically a dermal filler containing hyaluronic that has this high G prime quality, or it's a firmer type of a gel, something that will give not only volume but as well as projection. Okay, so I'll be using a so-called thick, firm, strong, robust filler, a hyaluronic type with high G prime. Okay, so since we've done already markings there, okay, so that's just a review, a bit review of anatomical landmarks, some blood vessels and nerve to avoid, and the anatomical plane. Now we'll proceed to the procedure part. Okay, so for this part, my technique will be more of the fanning method using a cannula. Okay, I'll be using only a cannula for this procedure, and my entry point will be at the lateral aspect, and I want to avoid the mentalis foramen there. I have a cannula that's gauge 23. You can use gauge 25. Okay, that's fine. Usually I have a habit of like checking on the length of my cannula there, since I want to reach this center point here. So clean the area again. So it's my habit to really be doing a lot of disinfecting or cleaning. Then we'll make an entry point on this aspect here, so we're avoiding also the mentalis foramen region there. And since I'm using a cannula and I'll be on the superficial plane, I'm avoiding that deep plane where you have your mentalis foramen. So for my entry point, I'll make a pinching of the skin here. So I'm using this kind of like if you have a gauge 23 there, ideally gauge 21, okay? Pinch the skin, so disinfect again. So it's always important to do that and pinch, okay? And rotate your needle there. And I have my material, my product here, and perpendicularly insert the tip of your cannula and glide it towards the center there. So what I'm gonna be doing this time is an antegrade technique of injection, okay? Because there will be some adhesions here. So your skin and your subcutaneous tissues are adhered, okay? Some fanning method, kind of going down, up, so pushing the material slowly and gently up to the center part there. So this is to improve also volume of the chin, the shape, projection, the length, okay? So anatomically speaking, I'm in the subdermal plane, okay? So we want to have that good volume. So product material, hyaluronic with the so-called high molecular weight or large particle size. Those with high G prime, something firm, something strong, okay? So I'm pushing as much as I can. So since we have more of a deficiency here, so if you notice, I'm also working already on the labiomentalis fold and then on the labiomental fold. So Ems is so young, she's just 24, okay? So this is not her fault. So this is something she inherited already, it's in their genes. So as early as now, we need to correct it. We will not wait when like 10 years from now, that will be the time to correct it. It's gonna like add a factor of the aging already there. So apart from correcting your short chin, your very like retruded chin, if you're not gonna be working on it right now, kind of like the following time, you'll need more syringes, okay? So I'm pushing as much as I can because this side here has more of the volume, kind of like not really that volume thing, it's more of a deficit over there, like a structural deficit, okay? And then once I reach the required volume that I need to use on this part here, I'll be going to the chin apex to push that remaining material, remaining product. So going on that so-called apex, okay, this part here on the center, I'll be pushing this. It's just gonna be a so-called bolus injection, okay? So this is on the right aspect of our chin. I'll be finishing the entire right chin. Then after that, we will be proceeding to the left side. I'll be adding another syringe, okay? Extra syringes for Ems, okay? The more the better, okay? Now, I want to further lengthen the chin of Ems. So to lengthen, especially for feminine chin, because we don't want to make it like squarish, okay? We still want to make it rounded, and we want to make it kind of like a sexier chin, okay? So what I'm gonna do also is to improve this mandibular region here, okay? Now my entry point will be on the inferior aspect of the mandibular line here, okay? So since we're targeting this center point here, and I also want to correct the deficiency here at this part, so we'll be using another entry point there. Okay, pinching, cleanse or disinfect. Okay, there you go. And there's a puncture there. You're still good?
Yes, Doc.
Okay, so I have now my entry point ready, and this is another syringe. So I've already used one syringe for her, and I'm gonna add another syringe. So this is correcting that projection and at the same time the length, okay? So I'll be doing a so-called more of an antegrade approach here. So it's different from the usual technique that we do, the retrograde. This one is more of an antegrade injection already, okay? So little by little, I'm pushing here, like I wanna give like a 0.2 on this part here, and I'm checking on the line of the syringe. So it's important that you see those numbers there. So the thing with our product is that they have these lines here that you need to check just to know how much are you already filling in. So little by little, I'm pushing, and a little bit more here. Gonna be pushing up to the 0.5 there, okay? Just to improve a deficiency of this mandible here. Okay, little by little. I need some more here, here, pushing there. And then we want to also fill in this part there till I reach that symphysis menti here. So this is already elongation, to elongate the chin region. So the goal is to make our face balanced and proportioned. So to do that, we can make use of our hyaluronic filler to improve such kind of deficiency. Okay, I've reached already almost the 0.5 line there. Then once I've done this 0.5 line here, I'm gonna go to the apex part again, inferior actually to the apex, because the first one we already injected there. Okay. So I'm in the subcutaneous plane, and I am avoiding any deep branch or any deep blood vessel branch there, okay? So this is to correct inferior to the mandibular line. So I wanted to improve more the length of the chin and get rid of that double chin under this part here, okay? So pushing a bolus of my filler product. So this is again using a cannula that's gauge 23 and a high G prime product, okay? So we'll be pushing some more and some more there, just to improve further the length. And ideally with filler, we do molding, we do massaging, okay? Just a little bit more, and we are done on the right side. Let's proceed to the opposite side. So we have done the chin treatment for EMS. We'll show the result when CSA Medical Aesthetics return. And we're back. So let's now show the result to EMS. EMS, here's the mirror. Look at your enhanced chin.
Ang ganda niya, Doc. Very natural lang
Exactly.
po.
And look at this surface. It's so smooth.
Yes po.
Very natural looking.
Yes,
An
Doc.
instant result. Okay.
Yes.
No signs of any bruising, swelling, and wow.
Yes, Doc.
Okay. So this is now Ems. So can you share with us like how was the experience during when we were doing the procedure?
Actually, Doc, wala po talaga siyang
Pain,
pain.
okay.
Yes po. Parang ramdam niya lang na merong parang manipulate. Pero
Yes.
wala po siyang pain talaga.
Exactly. And you also feel some kind of like heaviness.
po.
That's normal. That's part of it. The thing is, the hyaluronic filler has also a lidocaine with it.
Yes po.
So kind of, it also helps in any pain nor discomfort. Kind of like eradicating those discomfort
Yes.
there. Okay. So what we did on EMS was elongating and at the same time projecting. So we corrected the rickets E line and at the same time the 1/3, 2/3 rule. Okay, in the proportions of the face. So her lower third is already balanced with the upper and the middle third. Okay, and because I noticed also on the mandible region, kind of like a hypoplasia at the same time. I'm recommending with EMS next time, we'll be doing the so-called the angle of the mandible. So we wanted also to improve this part here, the jawline here. Just give that definition there. Still with the good lower third, and you know, for female shape of face, we wanted an oval shape or that inverted triangle or V-shaped contour.
Yes.
Okay, so thank you, Ems.
Thank you, Doc.
We're so glad that we were able to help you with it. I'm pretty sure it's one of your like before, right?
Yes,
You
Doc.
kind of like feel a bit insecure on
Yes,
this
Doc.
lower third of your face because you notice it's really that deficient, and over time, the
Yes,
more you
Doc.
notice it. And the thing is, if you've corrected it the earlier, the better. Don't wait for it to kind of like further recede. And the thing with the aging process, there's this bone resorption,
Yes,
so
Doc.
soft tissue atrophy, then further laxity of the skin, weakening of ligaments. So don't wait for that time. So if you already notice that you lack this chin projection and this kind of normal length, or the proportions are really inadequate or not within the right ratio or proportion, so the moment you notice it, do something about it. Correct it already. So this is the non-surgical method, because the others have an option of doing a surgical method by placing in an implant. Yeah. Though this one is a quick procedure, kind of like lunchtime treatment, coffee break treatment, okay? And no long downtime, okay? And natural results.
Yes.
Plus, we've used hyaluronic substances that are very natural. And this one can last long, okay? Because these are robust filler, high G prime with good chemical cross-linking. They're stable. They can last longer. Some people will still have fillers in their face for 2 years or even more. I've seen some people with fillers that they really stay for a very long time. And you can also notice a slimming effect on her face. With that elongation, it narrowed your face.
Yes,
so making
Doc.
your face sexier looking.
Yes, Doc.
Thank you so much to all of you. If you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Facebook, CSA Medical Aesthetics. Ems, do you have any like social media that they can like ask questions to you?
You can add me, message me on Facebook po, Emerlinda Manalo.
There you go. Just the name, Emerlinda Manalo. Thank you. And our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 and 0917-504-4268. Okay? If you want to see the other videos, we have a lot of topics you can just watch at our YouTube channel, Contessa Salvador. Please click the like and subscribe button. Okay, God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.